When it comes to foot gear, it's not recommended to use open toe shoes or tight shoes on patients that have diabetes, especially if they have deformity, poor circulation, neuropathy. And one of the reasons for that is, if you do have if you do wear an open toe shoe or you wear a sandal, you're exposing your skin to areas that might cause a wound. You might step on something, or you might have a bug, or I'm sorry, an insect incident where it causes infection to the area. There's no protection around your toes. It's not recommended to walk barefoot, especially in hot weather, especially if you walk in cement, because it could cause blisters, which could lead to skin breakdown, could lead to infections. It's not recommended also to wear tight shoes. It just adds pressure or shear to an area of your foot that could lead to a cut, that could lead to blistering. Boots are not appropriate because it adds pressure to your forefoot. It's also, usually they're pointy, so it causes tightness around your feet, especially around your toes. The best shoe gear that you could use is something that covers your toes, to protect your toes. An area that a shoe gear that has a wider toe box to allow some motion around your toes, prevent that tightness. Extra depth to offload your feet, especially when you're walking. Also, there's a material out there that expands, such as lycra covering or neoprene covering. It extends, so it doesn't, if you have a deformity, it doesn't allow that area to get shear force or pressure. It expands and it's very light. So tennis shoes is recommended depending on the type of tennis shoe that you're going to get. It should be supportive. It should protect your toes. Shoe gear that has leather covering could also be protective. But if you have severe deformities, if you have a bunion, if you have hammer toes, the leather material is not very, doesn't expand very well, so it must add pressure to the area. So it's, like I said previously, it's important that when you go see your foot doctor to take your shoe gear, to show them what kind of shoes you're wearing. And it's also important to avoid going to go see taking sandals to go see your foot doctor, because it doesn't allow your foot doctor to examine what kind of shoes you're wearing. And it gives us an idea that you are wearing something that does not protect your feet very well.